How do doctors choose the best UTI antibiotic? When you think about a urinary tract infection, it might seem straightforward, but choosing the right antibiotic is a careful process. Doctors don't just pick a pill at random. They consider several important factors to make sure the treatment works well and is safe. First, they look at how serious the infection is. If it's a simple bladder infection in a healthy person, they often start with oral antibiotics that target common bacteria. But if the infection involves the kidneys or causes symptoms like fever or chills, they might need stronger, intravenous antibiotics. Next, they consider what bacteria are likely causing the infection. Most UTIs are caused by bacteria called Escherichia coli, but resistance to antibiotics can vary by location and patient history. Doctors often check local resistance patterns, known as antibiograms, to see which antibiotics are still effective in the area. They also ask about past UTIs or recent antibiotic use, which can increase the chance of resistant bacteria. If someone has been hospitalized or has a catheter, the risk of resistant bacteria is higher, and the doctor might choose a different antibiotic. Before starting treatment, doctors often use guidelines to pick a first-line antibiotic. For uncomplicated bladder infections, common choices include nitrofurantoin or trimethoprim sulfamethoxazole because they are effective, safe, and concentrate well in the urine. For more complicated infections or kidney involvement, they might choose antibiotics like ceftriaxone or gentamicin, especially if intravenous treatment is needed. Doctors also think about the patient's individual health. If someone has allergies to certain antibiotics, or if they have kidney problems or other health issues, these factors influence the choice and dosage. Pregnancy is another important consideration, as some antibiotics are safer than others during pregnancy. They also weigh potential side effects and interactions with other medications the patient might be taking. Once the urine culture results come back, showing exactly which bacteria are causing the infection and which antibiotics they are sensitive to, the doctor can adjust the treatment. This step helps avoid unnecessary use of broad-spectrum antibiotics, which can lead to resistance. In patients with bladder cancer or those with ongoing bladder treatments, the risk of complicated infections or resistant bacteria is higher. In such cases, doctors are extra cautious and relying heavily on culture results and local resistance data to select the most effective antibiotic. This careful approach helps protect bladder health and prevent treatment failures. In summary, choosing the best antibiotic for a urinary tract infection involves assessing how severe the infection is, understanding which bacteria are involved, considering the patient's health and history, and using local resistance information. This thorough process ensures the infection is treated effectively while helping to prevent antibiotic resistance. Always remember, it's important to consult a healthcare professional for personalized advice and treatment.